that curve will start going back down and flatten, and we will be able to move forward. But it will take time. I think over the next few days, it will be especially telling to see where we are with regard to that curve and whether we can move forward with our reopening plans.
Our next question comes from Dominic.
Yes, hi. I am just curious about whether there is any indication yet of any trends among this 103 new cases, any sort of similarities or parallels among demographics, or if anybody is known to have participated in particular activities that may suggest there are reasons beyond just the general community spread for these new infections.
Yeah, so we are certainly taking a very hard look at that. To see exactly if there's any indication that this is tied to any specific event. We don't have any indication at this point that it's tied to a specific facility or an event, but with our contact tracing, partner notification efforts, we will do everything we can to better assess that. And right now, there is evidence that this is, as we have had in San Francisco since the beginning of the epidemic, there is certainly a greater representation of Latinx diagnoses in these cases, just proportionate to the population in San Francisco at large, and so we're seeing that pattern in this increase as well. I think again, it will have to be looking at the next few days in particular to see whether that pattern is sustained and to specifically answer the questions that you're asking.
Thank you, Dominic, for your question. For those of you joining late, to participate in the Q&A, select the participant button at the bottom of your screen and click the raised hand function, and we will unmute you. Rob Roth, go ahead.
Yes, can you say if the 103 are predominantly younger, or what sort of strata age group are we finding?
And again, I think I can't speculate on the 103. All those demographic characteristics are not yet available. I think the important thing is that the rate of diagnosis has increased dramatically. So compared to where we were in our data tracker, we've had a near doubling in the last couple of weeks of our rate of diagnosis of infections. That curve is now is quite steep. And I think, as we know, as we're seeing nationally and unfortunately at the state level, these curves in terms of cases precede a surge in hospitalizations by anywhere from 2 to 3 weeks. So we need to be very cautious and thoughtful as we move forward. And again, we are taking a close look in evaluating the demographics and the age distribution to see if with this surge, these new cases are significantly different, or how similar they are from our current our cases before this steep climb on the curve over the last few days.
Thank you, Rob. Our next question comes again from Karishma.
I am also curious, will there be a possibility that San Francisco can go into lockdown again if numbers continue to rise?
Well, we're taking a pause here. We're not reversing, and I think we're going to have to watch the data. I think one of the key points of moving forward, as we've always emphasized, that as we reopen, because there is more virus around than ever before, that people need to take precautions. I think this is a really important time to remind everyone to wear face coverings, to social distance, to basically not let our guards down, not let our collective guard down. If we do that, I mean, we know how to prevent this virus's spread. there's clear evidence about how to do that, given, again, the social distancing, the face coverings. There will be increased cases as we move forward. The key issue is to flatten that curve as much as possible, to slow the spread of the virus so that we are able to care for people and don't overwhelm our healthcare system. We're seeing that happening now in many states. We're seeing that happening, unfortunately, in Imperial County. We've actually transferred some patients from Imperial County to Zuckerberg San Francisco General Hospital. So right now, our hospital, the good news is our hospital capacity is good, but we're going to have to watch this and again, see whether this surge of increased cases, whether that surge continues and that curve continues to go up. And then secondly, whether that surge corresponds with an increase in hospitalization rates 2 to 3 weeks from now. This is, there's now data internationally, nationally, and statewide that unfortunately these patterns do happen with this virus, and we're doing everything we can, again, to slow it down by taking a pause right now.
Thank you, Karishma. Our next question comes from Veronica Shepard. Veronica, you have the floor.
Okay, I got lost. Hello, Dr. Colfax. As you know, I work out here with primarily African-American populations, especially our faith community. And I've heard today about outbreaks that have happened across the city. Will we be informed where those areas are so we can inform the people that we engage with daily where to be concerned and cautious about?
So we share the outbreak information as appropriately as possible to help inform our prevention efforts and the community and where we need to sustain our efforts. So if there are specific questions or concerns, we can certainly get back to you and other stakeholders on that.
Thank you, Veronica. And going forward, we would just ask that if you come from a media outlet, if you would also kindly indicate which media outlet you come from. Our next question comes from Alex.
Hi, Dr. Colfax. This is Alex at ABC7 News. Do you mind just taking a step back for a second and talking about the specific numbers that you guys have seen over the past 7 days or so, or even since yesterday, that you find most concerning as far as case numbers, positivity rate, and hospitalizations? Just getting a sense of those trends, please.
Sure. So basically, the trend rate is what I was talking about in terms of our increase. A few weeks ago, or on the 14th of June, and you can go to our data tracker and see this, we were at about, for our testing, we were at a 2.7 per 100,000 positivity rate. As of yesterday, we were at a 5.1. So we went from a yellow to what I think of as a high orange. And if that trend continues over the next couple of days, we could be in our red zone. So remember that our orange and red zones are the most concerning zones, and especially when we're red, it means that we need to really take a hard look and consider pausing or even reversing, which is why we've made the decision to pause now, to take a look and see where the data are headed. Our hospitalization capacity is relatively good right now, and again, that's available on the data tracker if you want to look at those numbers. As of last night, we had 45 people with diagnosed COVID-19 hospitalized across our hospital system, including and 27 of those were in our intensive care units, and that also includes a number of transfers from San Quentin and Imperial County. Right now in our hospital system, we have enough capacity that we are accepting the sickest, most in need from other parts of the state. And again, we will be watching that capacity closely going forward, especially in light of this surge in newly diagnosed cases, to see whether that again corresponds to an increase in hospitalizations 2 to 3 weeks from now.
Thank you. Friendly reminder, we do have the director for another 8 minutes. Our next question comes from Janie Har.
Hi, Dr. Colfax. Thanks for having this. I know that you haven't studied, like, where these new positive cases are coming from, but generally, is it a matter of people, letting down their guard, having family over, not wearing masks? And what more can you do, or can the state do to impress upon people that there's still a virus out there?
Well, we don't. We don't know yet what the root cause of this increase is. I think it's probably a combination of factors. I think we all, as a community, as a society, need to reinforce the importance of facial coverings. Offer people facial coverings. My mask protects you, and your mask protects me. So it's an act of empathy and of protection for others that one wears face coverings. So I think emphasizing that, doing outreach, ensuring that we're working with community. I think it's much more powerful for neighbors and community members to encourage each other to wear face coverings than the public health department saying to do it, right? So I think we really need to increase the social norms around facial coverings across our communities and neighborhoods in San Francisco. Social distancing, when people can do it, that's obviously a really key intervention as well. And I think, look, we've been in a situation now for a number of months. People are tired. It's hard to keep vigilance in this, and realizing that, supporting people's mental and physical health in this really difficult time, and realizing that there are steps that people can take to engage in safer ways that will mitigate the risk. The other piece that I think is really important to emphasize here is that we know from data that essential workers are at higher risk for testing positive. So another, as we delve into this data and work to get an early read on this increase, one question is, are we seeing higher rates of infection because more people are going back to work, and not everybody has the option to shelter in place. So reinforcing the need for access to testing, supporting policies that provide workers with access to testing and to sick leave and other resources in the event that they test positive, and ensuring that people know that if they test positive, that we will provide them with appropriate isolation and quarantine if they need it and can't do it on their own.
Thank you. Friendly reminder to indicate which media advisory outlet you come from. Next question goes to Aiden.
Hi, Dr. Colfax. This is Dean Vaziri from the Chronicle. Where are we at with contact tracing in the city? Is that program take off?
So we are continuing to scale the program up. Right now, again, you can see the latest data on our data tracker. As of yesterday, we were at over 80% of cases contacted and over 80% of their contacts contacted, which is a little bit below our goal of 90%, but certainly high, and certainly in comparison to other jurisdictions, quite high. We continue to expand that program, and again, we will be using that program to further investigate and get a better understanding of what is potentially driving this surge in cases.
Our next question goes to Shannon Lin. Shannon?
Can I just add around the contact tracing, just to give people a appreciation of the size and scope. Before the pandemic, we had under a dozen people doing this work for all of our infectious diseases across the city. And now we've scaled up the program to around 150 active staff in that field. And then we've trained nearly 300 people and can mobilize people from that cohort to do this work. So just a lot of work that's been done in improving that in increasing that over the last few months.
Thank you. Shannon, go ahead.
Hi, I'm from KQED, and I wanted to confirm whether or not there are any inmates from San Quentin who are currently hospitalized at any of the San Francisco hospitals. Are you able to confirm this?
I can confirm that yes, there are inmates from San Juan in San Francisco hospitals.
Do you know how many?
I do not have that information, but Jenna can certainly follow up and see if she can provide that information for you.
Our last question goes to Kate Larson. Kate?
Hi, Dr. Colfax. Kate Larson, ABC 7 here. I interviewed Dr. George Rutherford on Wednesday night with UCSF. Of course, he's a principal investigator for their contact tracing program. And he said that you could look on a map and see through their program that these outbreaks throughout the Bay Area are concentrated in the Mission District in San Francisco, in Fruitvale in Oakland, and in the Canal District in San Rafael. So are you also seeing that? And I also spoke to Matt Willis, the health officer in Marin County, as well this week, and he sort of echoed the same thing through their contact tracing program. If you look at the list, you'll see the same last name over and over again because, you know, it's from families who are living together, you know, many people in home. I'm wondering if your data this week is also turning up the same thing, that you're seeing this concentrated in specific San Francisco neighborhoods, and knowing that, what can the city do?
Yeah, so we have, again, you can go to our data tracker and you can see that the data are consistent with what you're describing and what Dr. Rutherford has noted, which is we have a disproportionate, COVID-19 is having a disproportionate impact on the Latinx community. I would say that this, we saw this happening, unfortunately, based on our admissions at our public health hospital, Zuckerberg San Francisco General Hospital, where very early on in the epidemic, we were seeing a disproportionate number of patients admitted who were Latinx. We have been working, again, from the early days of the epidemic with the mayor's Latino task force on COVID-19, ensuring that support services, education, the prevention activities are supported in terms of, again, the social distancing, the face masking, the hygiene, that we get testing on the ground in the community, that there's access to testing. And then I think that with regard to the contact tracing that we've talked about, we have over 50% of our cases are in monolingual Spanish, and that we've built a capacity to provide culturally appropriate services in that regard. And then also recognizing that this is more than just about testing, that this is about providing the wraparound services to people. Again, if people can't isolate or quarantine on their own, that we have hotel rooms available in the city for them. If they're concerns about food insecurity, that food is made available. And then I think we really need to be continue to work with employers and others, because we know not everyone can shelter in place. And how do we ensure that workers are being tested at an appropriate level, and that employers are supporting employees in getting tested, and then very importantly that they are supported in the time that they need off to ensure that they are healing, and that infection rate risk to others is mitigated.
Thank you, Dr. Grant Colfax, for joining us for the San Francisco Department of Public Health Media Availability. Any other last comments? And if you have no other statements, we will end our program.
Thank you, everyone. Bye-bye.